So good day ma'am, good day everyone. So for today, I will be discussing my assigned topic which is on sexual dysfunction. So here's the outline of my presentation. First, we are going to discuss about the background of our topic which is the sexual dysfunction. Next, we are also going to tackle about the types or kinds of sexual dysfunction, its predisposing causes or factors, clinical manifestation or signs and symptoms, diagnostic procedure, medical surgical management, nursing diagnosis applied, and of course, our health teachings. So first, we are going to tackle about background of our topic, which is the sexual dysfunction. So what really is this sexual dysfunction? So this sexual dysfunction covers the various ways in which an individual is unable to participate in a sexual relationship as he or she would wish. Parang tong term na sexual dysfunction, usually nagre-refer siya sa mga disturbances in sexual desire or functioning ng isang tao. So, although sexual dysfunction is usually thought of to be a male-related disorder, it may be associated with either the female or male gender. So, kahit na, or although common na nangyayari ito sa mga lalaki, pwede din siyang mangyari sa mga babae. So, it is a multidimensional phenomena composed of various psychological, social, and physical dimensions, for which there are now several effective options for treatment. To sum it up, our sexual dysfunction prevents a person from experiencing satisfaction from sexual activity. Traditionally kasi, yung sexual response cycle natin bilang tao, nag-i-include yung excitement natin, yung plateau, orgasm, and resolution. Dito sa sexual dysfunction natin, isa sa mag-partner or isa sa mga babae or lalaki, walang nararamdaman na any sexual desire kasi nga may defect yung sexual arousal nito. Next is, we are going to tackle about the kinds or types of sexual dysfunction. So, generally kasi, meron tayong 4 na major types. But later on, we are going also to discuss some of the sexual dysfunctions or types of sexual dysfunctions on each gender, which is the male and female. So, here we have major types of sexual dysfunction. First, we have the desire disorder or the lack of sexual desire or interest in sex. So, dito sa desire disorder, parang yung isa sa mag-partner or couple, it's either yung male or female, is walang nararamdaman na kahit na anong sexual arousal. For example, kahit na maghubad ka sa harap niya, or kahit anong gawin mo na pwedeng ma-arouse yung isang tao sa isang sexual activity, hindi siya maa-arouse, hindi siya magiging apektado kahit anong gawin mo. Yun yung desire disorder. Next naman is our arousal disorder, which is the inability to become physically aroused or excited during sexual activity. Dito naman, parang connected siya sa una, pero dito sa arousal, may ginagawa na. Yung kaibahan lang nila, sa desire disorder, wala pang ginagawa. Dito sa arousal disorder, may ginagawa na. May ginagawa ng activity or sexual activity, pero wala pa rin siyang nararamdaman. Kung baga, hindi pa rin siya affected. Next is the orgasm disorder. This orgasm disorder is the delay or absence of orgasm or the climax of every sexual activity. So, dito naman, di ba nga, mapababae man or mapalalaki, pagkatapos ma-achieve yung peak ng kaligayahan sa sexual activity, meron at merong lalabas. Dito sa orgasm disorder, pwedeng walang lumabas or pwede rin ma-delay yung orgasm ng isang tao. So, fourth is the pain disorder. So, dito naman sa pain disorder, very self-explanatory siya. Ito yung sakit na nararamdaman ng isang tao during sexual intercourse. Next, we are going to tackle about the types of sexual dysfunction in male. So first, we have here our erectile dysfunction or impotence. So this is the inability to achieve and sustain an erection suitable for sexual intercourse. Tong erectile dysfunction niya, nag-o-occur siya at any age. So, next, we have the classifications of erectile dysfunction or impotence. We have primary erectile dysfunction and secondary erectile dysfunction. So, sa primary erectile dysfunction, never been able to have intercourse with anyone. Wala pa siyang nakaka-intercourse na iba, meron na siyang erectile dysfunction. So, secondary naman, has succeeded in having intercourse before dysfunction occurs. So, dito, tsaka lang siya nangyayari or tsaka lang niya nakuha itong impotence na to pagkatapos niyang makipag-intercourse sa ibang tao. Next, so, most of people kasi incorrectly believe na tong erectile dysfunction is nangyayari siya psychological only. Pero, erectile dysfunction primarily physical in origin, but psychological factors alone or in combination with physical factors can also a cause of erectile dysfunction. Among the conditions associated with erectile dysfunction are hypertension, diabetes, hardening of the arteries, and other vascular disorders that interfere with the flow of blood to the penis and the mechanism of erection, high cholesterol, habits that worsen vascular disorders, just like abusing alcohol or smoking, trauma including injuries to the pelvis or spinal cord, certain types of surgery and radiation therapy, multiple sclerosis and other nervous system disorders, and depression. Next, we have here premature ejaculation. This occurs when a man ejaculates sooner during sexual intercourse than he or his partner would like. So we have also two classification, lifelong or primary, and acquired or secondary. Gaya rin siya ng classification ng una, which is the erectile dysfunction. So lifelong occurs all or nearly all of the time beginning with your first sexual intercourse. Nag-start siya during the first sexual intercourse. Yung acquired naman develops after you've had previous sexual experience without ejaculatory problems. So, gaya ng kanina, nade-develop lang siya after niya makipag-intercourse sa isang tao. So, this premature ejaculation has no exact causes. Hindi pa alam. Pero, it was once thought to be only psychological. So, doctors know now that premature ejaculation involves a complex interaction of psychological and biological factors, which includes early sexual experiences, sexual abuse, poor body image, depression, worrying about premature ejaculation, guilty feelings that increase your tendency to rush through sexual encounters, erectile dysfunction, anxiety, and sexual or relationship problem. Next naman, we are going to tackle about the types of sexual dysfunction naman sa mga female. So, first is we have here vaginismus. So, this vaginismus is the body's automatic reaction to the fear of some or all types of vaginal penetration. So, whenever penetration is attempted, your vaginal muscles tighten up on their own. So, parang dito sa vaginismus, it is the involuntary tensing of the vagina. These unintentional muscle spasms or muscle spasms occur when something, for example, a penis, a finger, tampon, or medical instrument attempts to penetrate the vagina. The spasms may be mildly uncomfortable or very painful. Sa vaginismus, the pain, you have no control over it. Occasionally kasi, you can get vaginismus even if you have previously enjoyed painless penetrative sex. Hindi mo siya parang haan mo mapakpakadaan isuna o korlat ta isunan. So we have here the causes of vaginismus, anxiety disorders, childbirth injuries such as vaginal tears, prior surgery, and fear of sex or negative feelings about sex, perhaps due to past sexual abuse or rape or trauma. Next, we have our anorgasmia. So this anorgasmia is the delayed, infrequent, or absent orgasm, or a significantly less intense orgasm after sexual arousal and adequate sexual stimulation. So we have causes of anorgasmia: trauma to the genital or pelvic organs. This trauma can be acquired from straddle injuries, for example, falling off a balance beam or a bicycle. Complications of surgery in the pelvic area, gynecologic operations, difficult childbirth, and prostatic procedures. Disease such as multiple sclerosis, spinal cord injuries, and diabetes mellitus. Psychological conditions such as anxiety, depression, or alcoholism. Certain kinds of drugs such as antidepressant medications, addiction to heroin and other opiates. In female with no other known disease or history of drug intake that account for symptoms of this condition, anorgasmia is considered as kind of female orgasmic disorder or FOD. So this FOD is diagnosed when the symptoms have occurred for at least 6 months. Next is we have dyspareunia. So natackle na ng ibang reporters ito, so we are just going to or pahapyawan na lang natin siya. So, dyspareunia defined as persistent or recurrent genital pain that occurs just before, during, or after sex. So, it is the term for recurring pain in the genital area or within the pelvis during sexual intercourse. The pain can be sharp or intense. It can occur before, during, or after sexual intercourse. The causes of this dyspareunia is vaginal dryness from menopause, childbirth, breastfeeding, medication, or too little arousal before intercourse, skin disorders that cause ulcers, crack, itching, or burning, infections such as yeast or urinary tract infections. Next, we are going to tackle about the predisposing factors or predisposing causes of this sexual dysfunction. So, we have two factors, the physical cause and psychological cause. For the physical cause, we have diabetes mellitus, heart and vascular disease, neurological disorders, hormonal imbalances, chronic diseases such as kidney or liver failure and alcoholism and drug abuse, side effects of some medications including some antidepressant drugs can affect sexual function. For the psychological cause naman, we have work-related stress and anxiety, concern about sexual performance, marital or relationship problems, depression, feelings of guilt, concerns about body image, and the effects of a past sexual trauma. Next naman, we are going to tackle about the signs and symptoms or the clinical manifestation of this sexual dysfunction. So, for males, we have the inability to achieve or maintain an erection or hard penis suitable for intercourse, or specifically this is known as the erectile dysfunction. Next, absent or delayed ejaculation despite enough sexual stimulation or the premature ejaculation or retarded ejaculation. Third is the inability to control the timing of ejaculation or early or premature ejaculation also. For female naman, we have the inability to achieve orgasm, inadequate vaginal lubrication before and during intercourse, and the inability to relax the vaginal muscle enough to allow intercourse. For both gender, we have the lack of interest in or desire for sex, inability to become aroused, pain with intercourse. Next, we have here the diagnostic procedure that are done to know if a person has this sexual dysfunction. So we have here physical exam, blood test, urinalysis, ultrasound, and psychological exam. For physical exam, this might include careful examination of the penis of the patient and testicle, as well as the vagina of our patient, and checking nerves for sensation. For blood test naman, a sample of blood might be sent to a lab to check for signs of heart disease, diabetes, low testosterone levels, and other health conditions. Gaya nga na na-mention kanina, one of the factors of this sexual dysfunction can be diabetes or other health conditions. For urinalysis naman, like blood tests, urine tests are used to look for signs of diabetes and other underlying health conditions that can cause sexual dysfunction. Next, ultrasound. This test is usually performed by a specialist in a clinic or in an office. It involves using a wand-like device or transducer held over the blood vessels that supply the penis. So, this ultrasound creates a video image to let your patient or doctor see if you have a blood flow problem. So, itong ultrasound na to, sometimes done in combination with an injection or medication into the penis to stimulate the blood flow and produce an erection. Next is we have here the psychological exam. So, this psychological exam, the doctor might ask questions to screen for depression and other possible psychological causes of sexual dysfunction. Next, we have here medical and surgical management done for sexual dysfunction. So, for medical management, psychological and speech therapy. Psychological intervention may be beneficial. Individual treatment focuses on understanding and dealing with gender issues. Group, marital, and family therapy can provide a helpful and supportive environment. Speech therapy may help male to female individuals use their voice in a more feminine manner. For sexual reassignment surgery naman, controversy exists regarding whether adolescents should be allowed to pursue SRS or many countries deny S to adolescents. However, early treatment may be beneficial in adolescents whose secondary sex characteristics, for example, facial hair, lowered voice, and breast development, have not yet developed fully. In such cases, parental involvement and approval are essential. Next, we have here our pharmacologic management. So, we have progestins. These agents may be used to inhibit the secretions of pituitary gonadotrophins. Gonadotrophin-releasing hormone agonists. So, GnRIH analogs produce a hypogonadal state by downregulation of the pituitary gland. Next, aldosterone agonist selective, antagonist selective. Aldosterone antagonists may block androgen receptors. Next, antineoplastics, anti-androgens are another group of agents used as first-line therapy for hirsutism. Oral contraceptives inhibit ovarian androgen production and are probably the first choice for young women with hirsutism who do not want to become pregnant. Next naman, estrogen derivatives. These hormones are used for replacement therapy in hypogonadism associated with a deficiency or absence of endogenous testosterone or estrogen. Lastly, androgens. Androgens are used for replacement therapy in hypogonadism associated with a deficiency or absence of endogenous testosterone. So, for surgical management, we have arterial revascularization for males. So, this offers patients the possibility of restoration of normal erectile function without the necessity of medication, injection, or devices. Next, venous surgery. So, venous surgery or the penile venous stripping surgery has been shown to be beneficial in correcting veno-occlusive dysfunction with outstanding results. The traditional complications of irreversible penile numbness and deformity have been virtually eliminated with the venous ligation techniques superseding venous cautery. Next, we have here our prosthetic surgery. So, penile implants are a permanent effective treatment for erectile dysfunction. A penile implant is also called a penile prosthesis. The implant is a penis pump-like device. It has two cylinders that are implanted in the penis and a pump in the scrotum that creates an erection when the patient squeezes it. For therapy naman, we have estrogen therapy. So, this is localized estrogen therapy, comes into the form of vaginal ring, cream, or tablet. This therapy benefits sexual function by improving vaginal tone and elasticity, increasing vaginal blood flow, and enhancing lubrication. So, the risk of hormone therapy may vary depending on the age. The risk of other health issues such as heart and blood vessel disease, cancer, the dose and type of hormone, and whether estrogen is given alone or with a progestin. Talk with your doctor about benefits and risks. In some cases, hormonal therapy might require close monitoring by your doctor. Next is Osfena. This medication is selective estrogen receptor modulator. It helps reduce pain during sex for women with vulvovaginal atrophy. Next, androgen therapy. Androgens, we all know that androgens include testosterone. So, this testosterone plays a role in healthy sexual function in women as well as men, although women had much lower levels of testosterone. Androgen therapy for sexual dysfunction is very controversial siya. So, some studies shows a benefit for women who have low testosterone levels and develop sexual dysfunction. Other studies show little or no benefit. Next is the flibanserin. Originally developed as an antidepressant, flibanserin is approved by the FDA as a treatment for low sexual desire or premenopausal women. So, next we have here the nursing management done during or on sexual dysfunction. First, we are going to determine stressors. These help the client or our patient determine the time dimension associated with the onset of the problem and discuss what was happening in his or her life situation at that time na pwedeng mag-cause ng sexual dysfunction. Next naman, encourage discussion of disease process. So, encourage client to discuss disease process that may be contributing to sexual dysfunction. We are also going to ensure that the client is aware that alternative methods of achieving sexual satisfaction exist and can be learned through sex counseling if he or she and partner desire to do so. Next is identify factors that affect client sexuality. So we are going to note cultural, social, ethnic, and racial and religious factors that may contribute to conflicts regarding variant sexual practices. Fourth, be accepting and non-judgmental. So sexuality in a very personal and sensitive subject, the client is more likely to share this information if he or she does not fear being judged by the nurse. Fifth, provide positive reinforcement. So we are going to observe client behaviors and the response he or she elicits from others. Parang kumbaga, give them social attention. For example, smile at them. 2 desired behaviors. Next, we have nursing diagnosis. For nursing diagnosis, we have 5. So first, sexual dysfunction related to physical or psychosocial abuse. Second, ineffective sexuality patterns related to conflicts with sexual orientation or variant preferences. Disturbed personal identity-related parenting patterns that encourage culturally unacceptable behaviors for assigned gender. Fourth, impaired social interaction is related to socially and culturally unacceptable behavior. And lastly, low self-esteem is related to rejection by peers. Lastly, we have our health teachings. For our health teachings, some types of sexual dysfunction cannot be prevented. However, you may be able to reduce your risk for certain types of dysfunction by working to prevent disease that can lead to dysfunction. Adopting certain healthy habits may reduce the risk. For example, encourage the patient to stop smoking or don't start smoking. Encourage them to get regular exercise, including aerobic exercises. Encourage also them to maintain a healthy weight, eat a well-balanced diet, limit alcohol intake to a maximum of 2 drinks per day, don't use illegal drugs, and if they have a chronic diseases like heart disease or diabetes, take steps to control the condition and improve the overall health, and of course, encourage them to follow a healthy eating plan. So that would be my presentation. Thank you for listening.